CSF Rhinorrhea. It is the leakage of CSF into nodes. It may be clear fluid or mixed with blood. The etiology of the CSF rhinorrhea can be divided into traumatic and non-traumatic. Traumatic is more common, around 96%, and non-traumatic around 4%. Under the traumatic, it can be due to accidental or surgical. Accidental around 80% and surgical around 20%. Under the non-traumatic, it can be due to inflammations like mucocele, sinusal polyposis, fungal infections, and others, and it can be due to neoplasms, benign or malignant, and congenital lesions, which include meningocele, meningomyocele, meningoencephaloceles. Others include idiopathic, Now the symptoms of the CSF rhinorrhea include unilateral nasal discharge, and the discharge can't be sniffed back, sweet in taste, and increase on bending down and straining. There is history of head injury, nasal surgery, or skull base surgery. And other symptoms include headache, Now the sites of the leakage are shown in the figure. The figure A represents frontal sinus, B indicate ethmoidal, C sphenoidal, and D eustachian tube. Now the different signs seen in the CSF rhinorrhea include handkerchief sign, so in handkerchief sign, when the nasal discharge stiffens the handkerchief, but CSF does not stiffen. Another sign is halo sign, or it can be also called double ring sign or target sign. Now in the figure we can see when the discharge is placed on a piece of filter paper, the central spot shows blood and peripheral spot shows CSF. So this is the target sign. Another sign is T-spot sign or reservoir sign. On bending his head, fluid collected in this sinus empties into the nodes. This can be seen when bending his head. So now the differences between the CSF rhinorrhea and nasal secretions. So in CSF rhinorrhea there is history of surgery, injury, tumor, and on nasal secretion there is history of sneezing, stuffiness, itching, and discharge is few drop or stream of fluid, but there is continuous discharge in the nasal secretion. And the CSF rhinorrhea is aggravated by straining or forward bending, but nasal secretions are aggravated by allergy, infection, crying. CSF rhinorrhea can be sniffed back, CSF rhinorrhea cannot be sniffed back, but nasal secretion can be sniffed back. And seeing the discharge it is thin, watery, clear in CSF rhinorrhea, while nasal secretion is mucus, mucopurulent tears. And the taste is sweet in the CSF rhinorrhea while salty in nasal secretions. The sugar content are more than 30 mg per deciliter in CSF rhinorrhea while less than 10 mg per deciliter in nasal secretion. So, and the last beta 2 transferrin is the most specific for CSF and is present in CSF rhinorrhea but absent in nasal secretions. Now in the CT scan, here we can see the leakage of the CSF into the nasal, and on direct nasal endoscopy here we can see the CSF. Now the CSF tracers, it helps to localize the CSF from which side the CSF is leaking. Now the different tracers are fluorescein, and under the radionuclide markers there is radioactive iodine, technetium, serum albumins, and many others. And in the radio opaque dyes there is metrizamide,